We'll do an intro. So again, welcome everyone to the State of Alaska Immunization Program update. We are pleased to have Sarah Aho here today with us. Today is January 19th, and we'll be discussing the Alaska's Immunization Information System, VacTrAK, and hopefully fill in a few gaps and open up the mic to some questions and see if we can provide some information sharing forward. So to kick it off, I do have just a couple polling questions. So first polling question, do you currently use VacTrAK in your center? And I'm gonna wait for a few more of you to answer that. So first polling question, do you currently use VacTrAK in your center? All right, it looks like about 50-50 so far. All right, so it looks like about 60% of folks that responded are currently using VacTrAK. That's great. And there's a couple that are not. So this is a timely presentation. So next polling question, please. Does anyone in your center have access? With staff turnover, this is kind of a big question. Again, thank you guys for participating in the polling. All right, it looks like about 3/4 said yes, and there's one that no. So thank you guys for participating in the polling question. And again, welcome to this sponsored presentation from Mountain Pacific Quality Health. My name is Jessie Kinsey. I'm account manager, and I am so grateful to pass the mic to Sarah to present on VacTrAK today. Thanks, Sarah.
You're welcome. Thanks for having me. And if you have any questions, feel free to interrupt or type something in the chat, although I won't be following that as closely. So my name is Sarah Aho. I'm the program manager for the immunization program at the state of Alaska. And I've been in this role since August, so don't ask me too hard of questions, but I've been with the immunization program since 2016. I started out in education and training, and then I worked with the VacTrAK team, and then I came back and worked on COVID vaccine response. So I've done a number of things with the program, and I really love working here, and it's been really fun to learn how to be kind of the big picture thinker as program manager. I'm really enjoying this position too. So we're going to talk a little bit about standards for adult immunization, talk a little bit about VacTrAK, review some vaccine updates that have happened in the last year, and then I will share about Docket, which I'm really excited about, and then we'll wrap up with the Alaska Vaccine Assessment Program, which is AVAP. And if some of that sounds a little bit like gobbledygook, that's fine. And if you're familiar about it, that's great too. So we'll start off with just reviewing the standards for adult immunization practice. This is from CDC, and just really part of the goals of standards for all healthcare professionals and working with adults is really to assess the immunization status of your patients in every clinical encounter. I know that you all interact with your patients differently than maybe someone who's in private practice, but I think these standards can still apply in thinking about vaccinations and thinking about immunizations. And really, VacTrAK can help with this too, in looking at an immunization record and seeing if someone is up to date in their vaccines. Really making a strong recommendation for vaccines that patients need, and then either administering that vaccine if someone is due for a vaccine or referring them to somewhere that does administer vaccinations. And then, of course, documenting what vaccines are received by patients. And that brings us right into talking some about VacTrAK. So every state in the US has their own Immunization Information System, or IIS, and ours is called VacTrAK. So this is an online web-based immunization information system. It's really a population-based registry, but it's very dynamic. We have a huge amount of vaccinations reported in VacTrAK. And in Alaska, it is actually state law that all vaccinations given in Alaska are required to be reported to VacTrAK within 14 days of administration. So this really allows for the State Department of Public Health to have a good assessment of where Alaska is in terms of our vaccination coverage. We want to know how well protected our population is at different age groups at different times. For flu season, you'll remember when COVID started in 2020, and the next flu season, we were really worried about hospital capacity of COVID and flu, and really we were watching closely to see what our flu vaccine coverage rate was to assess, how are we doing? Do we need to do more promotion for flu vaccine? How do we track our COVID vaccine uptake? All of these pieces of information are ways we can make decisions in public health for the state. And also we use VacTrAK for that data and for that information. And then for you, you can use VacTrAK and look up patient records and determine if the patient is up to date on their vaccines. This is just a short list of a few items required when vaccines are documented in VacTrAK: basic demographic information, the primary provider's name, the vaccine administration date, what vaccine is given, and the VIS, as well as a few other pieces of information. VacTrAK is really helpful in that it is a consolidated immunization record for your patient. It can reduce staff time in searching for records. It's all in one place. And it can also help forecast future immunizations needed based on ACIP recommendations. Also, you can use this as an official vaccination record. I know for school and childcare, that's maybe not your demographic, but also useful to know as parents potentially. And then if you are administering vaccines, it can help with your vaccine inventory and ordering, and also does have some reminder recall functionality if you want to, just check in and want to send out reminders to patients or things like that. Also, it can help assess coverage rates at your facility, depending on how you're set up. And we can talk more about that, or if you have specific questions, happy to try and answer your questions too. So we do have a daily training about VacTrAK, and it's really just kind of an open house training session. Every day Monday through Friday, we have an hour-long session open on Zoom, and people are welcome to come with any VacTrAK questions, whether that's how to pull a coverage rate report for your facility, or even like how to enter vaccine information or ordering questions. We're happy to help at those open sessions every day.
Sarah, this is Jessie with Mountain Pacific, and I just had a question for you.
Yeah.
Is VacTrAK set up on a platform that will communicate with EMARS?
Yes, it is. Yeah, we do a lot of, actually most of our messaging and incoming data comes through HL7 messaging. So we work with each facility to go through a testing phase and onboard those facilities with their medical record systems, and they can report directly to us. And a lot of them have bidirectional data, so that if someone gets a vaccine somewhere else, that can get updated in their VacTrAK record, and then it can also update into your EHR.
And is that platform dependent, or is that pretty standard across the board? You don't have to worry about having certain software.
It's pretty standard. Yeah. I think we've worked with, I don't think we've ever been unable to do that.
Okay. All right. That's very helpful. Thank you.
Yeah, you're welcome. Yes, we're happy to work with people. And just keep in mind that it is a state requirement to report to VacTrAK. So if you are administering vaccines in your facility and you're not yet, we would love to talk to you and get you set up with VacTrAK access. Right.
Sarah, can I ask one more question? What's the turnaround time to get access for a nursing home?
I don't think it would be very long, maybe a couple of weeks. at the max. I mean, really, there's a VacTrAK provider agreement, and I can put a link in the chat when I can pause for a minute. But
Sure.
yeah, it really is dependent on having all the paperwork and documentation signed, which is really a pretty short process.
Okay. And there can be multiple users?
Yes. Yes.
One. Okay. All right. Thanks, Sarah.
You're welcome. Good questions. So I'm going to shift away from VacTrAK a little bit, but if you have more questions, I'm happy to answer them. Or if you want to come back to anything, happy to answer that too. I wanted to run through just a few vaccine updates in case you aren't familiar with it. I just wanted to briefly touch on COVID vaccine updates, which I know has been a hot topic for a couple of years. And I will say that at this point, everyone 6 months and older is eligible for a COVID vaccine and also eligible for a bivalent updated booster. Typically, that schedule looks like this. So anyone who's completed their primary series and it's been at least 2 months, and then they receive a bivalent booster. I will also say that if you don't have the staffing capacity to do boosters right now at your facility, we do have a contractor who can help with that. So please feel free to send me an email if you feel like you just need some staffing support for vaccinations. We've heard that that's a problem throughout the state, and we do have a contractor right now who's helping with COVID and flu vaccinations. So if you need help, please let me know, and I'm happy to coordinate that. And just looking at COVID vaccines, we've seen that it is incredibly helpful in preventing hospitalization and death among adults, and especially among older adults. So this is a little bit older data. It's from June 2022, but just thinking about hospitalization rates, and unvaccinated adults had a much higher rate of COVID-associated hospitalization rates compared to those vaccinated with at least one booster dose. And at that time, this was looking at just the monovalent booster dose. We're still waiting on effectiveness data from the bivalent booster, but we expect to see pretty big improvements using the bivalent booster as well. And again, this is looking at a little bit older data from July, but looking at vaccination status and deaths, and looking at people ages 50 and older with boosters had a much lower risk of dying compared to people who were unvaccinated. And again, that's even significant when you're looking at people with one booster dose compared to 2 booster doses. So I look forward to seeing some more data from the bivalent booster, and I'm sorry I don't have that to share yet today. So those are like my very brief COVID vaccine updates. I did also want to touch on pneumococcal vaccine updates. This is a really important vaccine for older adults. And we've also had some changes in the last year and a half. And sometimes I know vaccine changes have been a little drowned out if it's not COVID related. So I wanted to make sure you are all aware of the changes in these recommendations. So just really briefly, for adults ages 19 through 64, with these risk factors, there are recommendations for pneumococcal vaccines. So you can see this is a pretty comprehensive list of risk factors for pneumococcal disease, including alcoholism, chronic heart disease, chronic liver disease, chronic lung disease, people who are smokers, and then also people who have diabetes. So this is a pretty big list of risk factors that do qualify people younger than 65 to get pneumococcal vaccines. And those recommendations are, if you haven't had any pneumococcal vaccine, CDC recommends a dose of PCV15 or PCV20. And then for those who have only received PPSV23, they can then get a dose of PCV15 or PCV20. And then for those who have received PCV13 with or without PPSV23, CDC recommends giving PPSV23 as previously recommended. And so again, like what these mean is those PCV13, 15, or 20, they're protecting against more and more strains of pneumococcal bacteria. So it's really, or sorry, more serotypes of that disease. So We just added PCV20 in the last year to our formulary, and we just added PCV15 in December. So now all of these vaccines are available through the immunization program, and we'll talk more about that later too. And then for older adults, pneumococcal vaccine is recommended for all adults 65 years and older. And really, these are a little convoluted and you can read them, but I'll read the highlights. So for anyone who's not previously received a pneumococcal vaccine, they're recommended to get 1 dose of PCV15 or PCV20. And then if they use PCV15, it should be followed by PPSV23. And then if PCV20 is used, they do not need to get PPSV23. And then for adults who have already received PPSV23, then they can get a dose of either PCV15 or PCV20. And then for adults who have received PCV13, they're recommended to get PPSV23 as previously recommended. So there's a lot of nuance to this, and it's really dependent on what your patient has already received. So there's an app for that. This is from the CDC. It's really useful. You can enter your patient's information and what they've already received, and it will give you guidance on what pneumococcal vaccine your patient is due for and when. So this is the Pneumorex Vax Advisor. It's a real mouthful, but very useful, very useful. And then we have a number of recommendations that you can reference to. We have 2 Alaska Epi bulletins. This top one listed is really highlighting the update to use PCV15 in our formulary, which I think is a little bit more relevant for children than for older adults. And then the second bulletin listed covers the updated adult pneumococcal vaccination recommendations. And then the 2 documents linked below that are the MMWRs from the CDC. All right, so shingles vaccination has not had an update in a couple of years, but I did just want to mention it as an important vaccination for older adults. So really adults 50 and older should get 2 doses of Shingrix separated by 2 to 6 months. And you can get Shingrix even if you've had shingles or even if you've received Zostavax, and if you've received the varicella vaccine, which protects against chickenpox. All right, and I'm sure you all know, but chickenpox and shingles are related. They're caused by the same virus, but you can still get a Shingrix vaccine, whether or not you remember having had chickenpox. All right, so that's my quick Shingrix 2 slides. I will talk a little bit about flu vaccine now, and I'll pause and say if anyone wants to chime in and comment or share anything about flu vaccination efforts at your facility, I'm happy to hear about it. All right, well, feel free to chime in the chat as well. Oh, there is stuff in the chat. Oh, thank you. Thank you for posting the link. Yay, I'm so happy you enjoy that app. It is really useful. I've heard a lot of good feedback from it, so I always want to tell people about it in case you don't know. All right, so we will talk some about flu vaccine, which I'm sure you are all quite familiar with, but also just a reminder that flu vaccine can be given at the same time as other vaccines, including COVID-19 vaccines. And that can be the adjuvanted or the high-dose influenza vaccine. And we're seeing flu and COVID still circulating in our communities. Alaska has a pretty long flu season, and we're not done yet. We've seen a big increase in cases this fall and winter, and we will likely still continue to see cases throughout the winter and early spring. So routine flu vaccines are recommended for everyone age 6 months and older who don't have any contraindications. flu and COVID can be given at the same time. So this year, or this flu season, all flu vaccines are quadrivalent, which means they protect against 4 different strains of the flu. Depending on which vaccine you get, they protect against slightly different strains. And then an important factor is that in June of this year, or of last year, the ACIP voted to recommend the use of specific flu vaccines for adults aged 65 years and older. And that is for that higher dose and adjuvanted flu vaccine. So in previous years, the CDC had really only, they didn't make a preferential recommendation. There is a high dose flu vaccine available for adults 65 years and older. But this year is the first season that CDC actually made that strong recommendation that people age 65 years and older should get that high dose or adjuvanted flu vaccine. So we know that older adults are at increased risk of severe illness from the flu. And this is a target population for our flu vaccine. And Alaskan adults do a great job of getting their flu vaccine, which is awesome compared to the rest of our population anyway. So yeah, let's see. Yes, so adults 65 years and older can get any flu vaccine, but the CDC did recommend preferentially to get either that Fluzone high dose quadrivalent or the Fluad quadrivalent. So the Fluad quadrivalent, sorry, I'm getting ahead of myself. So the Fluzone high dose contains 4 times the antigen compared to the standard dose. And then the Fluad quadrivalent, it contains the same amount of antigen, but it also contains an MF59 adjuvant. And an adjuvant basically just kickstarts the immune system. As people age, our immune systems don't have as good of a reaction sometimes. So an adjuvant is something that can really help boost your immune system's response. It's similar but different to the Shingrix vaccine. If you've gotten that vaccine, it can hurt a lot, and that's partly that adjuvant kicking in your immune system to have a strong reaction to the vaccine, which means your body is going to remember that virus better and protect against it. So if your facility orders and participates in ordering vaccine from the state immunization program, this is the flu vaccines we're offering this season. So you can see we do have that Fluzone high dose at the bottom, and then the second to the bottom is that Fluad recommended for 65 years and older. Just curious, if you have a show of hands, or if you can put a little like thumbs up sign or something in the chat, do you know how many of you are enrolled to receive state supplied vaccine? I'm just curious. You can put a thumbs up in the chat if you are. I'm curious. And if you aren't, that's fine. All right, well, it looks like maybe none of you are. However, I will say you are welcome to sign up to receive state supplied vaccine, and we will talk more about that at the end.
Sarah, there's a couple comments. It looks like Ivan with Alaska Pioneer Homes, they had a really good uptake this last fall with flu and COVID clinics from residents and staff.
Oh, awesome.
So that's great to hear. And then it also, Stacia said that she marked to start receiving, I'm guessing, allocation from the state.
Great.
And just wondering that email address to sign up to become a new user. Is that for VacTrAK, Stacia?
Yeah, sorry. I'm wondering what email address the invite for a new user setup comes from. I'm trying to find, I got mine, but one of my employees, doesn't know where her email went, and I'm not sure how to trace it. So it is.
I would reach out to VacTrAK, and I did just put VacTrAK's email address in the chat, but it's just VacTrAK@alaska.gov, and they should help you be able to track it down.
Okay, thank you.
Yes, that is a great. If anyone has VacTrAK questions and like to sign up or to have user questions or permissions questions, that is a great email to go to, and it will get to the right people.
Sarah, I have a quick question alongside that too, just as staff changes over. A VacTrAK question. If you are an active user in one facility and you become employed in another facility, do you have to restart initiation for access, or can you just change facility?
It depends. If you're in the same organization, you can just change facilities. But if you are going to a new facility with a different email address, then you would just need a new user account for that. Just so it's connecting you to the right place.
Okay. All right. Perfect. Thank you.
Sure. Yeah, and since not many of you are really receiving state supplied vaccine, I won't touch on this for very long, I promise. But really, when we're thinking about vaccine that the immunization program provides different clinics, we really do track dose level accountability. So we want to know where every dose is going that we are distributing. And that's really a CDC requirement. But basically, since COVID started, we've really offered universal flu vaccine coverage for the state. So anyone, sometimes, well, in other years, we have some limitations on what patients can receive a state supplied vaccine. But given COVID, we've just opened the door for flu vaccine. So that's been really helpful in hopefully getting improved flu vaccine uptake. And I'll skip over this, but this is really just talking about what vaccines we offer. And then again, we already reviewed this on a slide that was a lot easier to read, but looking at flu vaccine choices in VacTrAK and that the state is providing. All right, so I will briefly touch on Docket, which is a new project I'm really excited about. It is a Vaccination Records app. It allows everyone with a smartphone to be able to view their vaccination record. And how this works is you download the app, and then you have to enter some of your demographic information, and then it connects to VacTrAK, and it lets an individual look at their own vaccine record. It can show what they're coming up due for, and it also lets them see, what they've already received, as long as that record is in VacTrAK. So you can also do this for your children or your dependents, as long as your records are kind of linked in VacTrAK. And the way it links is really based on having an updated email or an updated phone number in VacTrAK, and that being the same email or phone number that connects to that you're using to log into Docket with. Lori, that's great. I'm so happy to hear that you are using it and that it works. Yeah, so this is a pretty new app. I think we launched it in October, and we've heard almost only good things. So we're really happy to offer this to Alaskans as a way to really be in charge of their health records. We want people to be able to access their own immunization records and use them. So there is a QR code there on the screen. Also, the website vaccinationrecords.alaska.gov has a link for Docket. And then we also have some posters available that either you can print if you want to share these with folks, or if you'd like to order a printed copy, you can also email Docket. So happy that you use that, Lori. And yeah, I encourage everyone to use it, especially, well, not as relevant for this group, but especially for kids going back to school. This is a way to get an official immunization record for those kids.
This would be nice too, Sarah, if part of discharge planning, if you had a resident, I'm just talking out loud, but if you had a resident maybe that was just there for a skilled stay and they received their booster, that you gave them this information upon discharge that they could access their updated records through this app. This would be kind of cool as part of that discharge planning.
Yeah, we're really happy to support people using this. And, the hope is that also people can make decisions about, oh, I see I'm due for my flu shot this year, or I'm due for a TD. I mean, I think a lot of people are overdue for their tetanus containing vaccines. And that's a great way to check and just be aware of what you're due for and what you've received that's in your vaccine record. Yeah, also, Lori, Yes, really useful. It does have a QR code with vaccine records or with your COVID vaccine. And that used to be a bigger requirement for some places to travel outside of the US or to other places that you needed to prove your COVID vaccines. This app is compatible with most places that require a COVID vaccine record. Yeah, so happy to hear you're using it. And yeah, if you want any posters, please feel free to reach out too. We have them printed in multiple languages as well. All right, then I will talk briefly about AVAP. So this is our adult vaccine program in a way that we provide vaccines for adults in Alaska. So the way AVAP works is really for insured patients. So patients with insurance, their insurance companies pay into AVAP. And the benefit for them is they have discounted cost of vaccines through the state. And then additionally, healthcare providers can also opt in to cover the cost of vaccines for their uninsured adults. So we have an assessment rate, which is per person per month. And so for 2023, the assessment rate for adults is $1.51. And so that would be per adult per month. So if you saw adults in your facility who are uninsured and you wanted to offer them vaccines, like you could opt into AVAP to cover the cost of those vaccines at a discounted rate than privately purchased vaccines. So we actually do have our AVAP enrollment open right now. And the link is here for that SurveyMonkey. And then we also have our formulary. Oh, I think that's on the next slide. But these are the list of vaccines that we offer through the state for adults. And you will notice that COVID is not on this list right now. Right now, COVID vaccine is funded at no cost through the federal government. That will likely change sometime mid-2023. And when that changes, we will include COVID in this list for adults. I will state that, of course, this is optional. And also you can enroll to be an AVAP provider without opting in, which costs really nothing. So if you wanted to opt in for state supplied vaccine for adults, you can certainly do that. And then opting in for uninsured adults is an option. The big caveat to this is we do still have some adults that are not eligible for state supplied vaccine. And that is people who only have Medicaid, Medicare, or Veterans Affairs insurance, or any insurance that does not cover vaccines. And that's a really short list at this point. So that does get a little bit complicated, and depending on what your patient population looks like, you may think like, well, this program maybe isn't right for me, or you may think like, wow, why haven't I signed up for this before? So either of those is totally fine. Please feel free to reach out if you do have questions about any of this. And again, like that provider opt-in is really to cover uninsured adults at your facility. So that is a brief summary of AVAP. And then, yeah, that SurveyMonkey link is open now for providers to opt in to cover their uninsured population. So that's my quick AVAP update. And then that actually is my last slide. So that was a little quick, but I tend to talk fast when I get going. So if you have any questions, we do have the VacTrAK email. I didn't list that on here, but VacTrAK@alaska.gov. If you have any COVID vaccine questions, we do have COVID-19 vaccine at alaska.gov. Our general helpline for general vaccine questions is immune@alaska.gov. And then I'm also putting my personal email in there, which is sarah.aho@alaska.gov. So happy for any questions anybody has.
Thank you, Sarah, and feel free to come off mute if anyone has any questions. I have a couple more about VacTrAK, Sarah.
Great.
So as far as prerequisites to sign up to be a user of the system, is there anything besides the non-traditional user information?
You know, there are, and I am just not super well versed in them. I think the biggest thing is really just being a part of a facility that's administering vaccines or has a need to review vaccination records. And that is really it. So I'm also gonna, now that I have my screen closed, I'm gonna share a few more links in the chat. So this is the general VacTrAK webpage. And actually, I'll share my screen again here.
Would you be able to pull up that webpage and kind of show us what it would look like to log on?
Yeah, I can do that. So this is VacTrAK's webpage. This isn't the logon page. This is just kind of our informational page, but generally highlights what VacTrAK is. And then also we do have a COVID vaccine webpage that's separate. And then a reminder here that effective December 29th, 2013, healthcare providers are required to report all administered vaccines within 14 days. So that is important to know. And we also have our VacTrAK user roles and responsibilities. So this is a really detailed document that if you're looking to enroll in VacTrAK, I'd encourage you to read it and just think about, making sure you meet these requirements. You did mention like switching facilities, and we do have a facility change form. So we have this request to add or modify VacTrAK users. So really, if you're a new user or if your facility is new to VacTrAK, you first would fill out this provider contract. So this is a contract basically highlighting, well, sorry, scrolling while watching is really dizzying, but filling out what your facility or organization and facility information, and then really looking at, how many patient records you're dealing with. If you're participating in the Alaska distribution program, so that would be that AVAP program for adults, or if you're interested in participating, and then also looking at electronic data exchange or how you would be transmitting that information. So some people do manual data entry so they can actually log on to VacTrAK and enter information. Other people do electronic transmission through HL7 messaging. And this is something that if you don't know the answers, it's okay. We can help you figure it out too. And then looking at definitions. So having authorized provider, ensuring that we are protecting data and treating things appropriately. And then accessing our services. And I'm just noticing that we need to update this document because we are now the Department of Health and no longer the Department of Health and Human Services. So that's our general agreement with hi doggy, with lots more in there. So that would be another document to start with. And then secondly, we do have this request to add or modify VacTrAK users. So if your organization or facility is already set up and running with VacTrAK, but you'd like to add users or you want to change anything about users, this is the form you would use on that. And then all of these would go to that VacTrAK email address. So that is our general enrollment with VacTrAK. And then we have a number of resources. So a number of quick reference user guides on how to search for a patient, how to view vaccinations or add vaccinations, how to do a coverage rate report. I know we also have adult options in here, not just child and adolescent. And then, we talked some about reminder recall. If you wanted to pull a list of patients that are due for a vaccine, one way to do that is looking at a reminder recall, which would give you a list of patients and not just one by one. And then we have a whole section about electronic data exchange, which is really looking at that interoperability and HL7 messaging. And then some resources for the VacTrAK brochure. And then I will also go to the vaccination records page. So this really gives people a few options for how to access their own vaccination record. One is to download Docket, which we talked about, but we also do have a faxed form or mailed form, sorry, not emailed form. We do have a form that people can request if they don't have a smartphone, or if they don't want to use an app. They can certainly still request a paper copy of their form from us, and we can provide that. And then really also people can request a copy of their record from their own healthcare provider. This used to be the only option until about 2 years ago, and I'm just so excited at the progress we've made in getting people their own vaccine records. It's just kind of remarkable that's taken so long, but I'm really happy that that's an option now. All right, I see there are questions in the chat, so I'm going to go over there. Oh yeah, it is yeah, thanks for that feedback, Lori. Just commenting on extending the length of time an account stays active without logging in. I don't remember off the top of my head what that time is, but I know I have also maxed it out. And I actually started making just a calendar reminder of like, hey, log on to VacTrAK, because I don't use it every day or even every week. But yes, I agree with that comment. Yeah. Any other questions or comments?
Is anyone willing to come off mute and ask any questions? Or I hope this is of interest for those that are not enrolled to enroll. I think it'll be helpful too to run reports and utilize some of the programming to see who is due for what. I feel like that is always helpful in our long-term care centers.
It's really helpful, yeah. And yeah, I guess also those VacTrAK sessions at noon every day can be helpful if you need help with any of those reports. Sometimes our VacTrAK reports are not intuitive. You hope they would be, but they are not. So I totally understand that they are a little confusing, and also you want to know that you're doing it right when you're getting patient data out of it. So I'd encourage you to check out those sessions if you do have any questions. And happy to see, Kate, that you are downloading Docket now. That's exciting. Yeah, and it is, Lori, your comments are fun to read. So yeah, it's really interesting to see how far we've come with our immunization registry. It is, yeah, one of my former colleagues kind of helped with the setup and implementation. And I mean, coming into it now, even the last 6 years, it's remarkable to see how things have changed, but also remarkable to think that this used to all be paper. And I think that's kind of amazing too, to think about, you know, compiling state vaccine data in such a different way. Yeah, yellow cards. So the immunization program stopped giving out yellow cards right when I was starting in 2016, and that was a really big deal. So I think, you know, it's been 6 years from when we stopped giving out yellow cards until now we have a Docket app. So I feel like, you know, in that time frame, it was a little bit of a gap in a really efficient way for vaccine documentation. But in that time, we were really encouraging people to get their vaccine records through their healthcare provider, and I'm really happy we have Docket now to share.
What a wonderful resource. I hope other states take follow. I'm hearing rumors, but you guys, I believe, really led this launch for as far as community access. So,
well, we are one of, I want to say 9 or 13 states who use Docket. So it is a nationally available app. And we are definitely one of the early adopters, but it just takes time, and different states move at different paces. But really happy to see that. And I guess, Jesse, that triggered something else I wanted to mention is we're in the process of doing a project where we're actually connecting to, or we're starting to work on connecting to other states' IIS. So we actually currently, VacTrAK is connected to the VA. So any patient who's received a vaccine at the VA, as of October, it will also show up in VacTrAK. So that's a huge success. Yay, Kate, happy that worked for you. Yeah, so VacTrAK will also now be getting records from the VA. We don't have all the historical records yet, but we will be moving that direction. And then starting in about March or April of this year, we're planning to start connecting to other states' IISs. So sometimes there's some concern about privacy, but we also know people move around a lot in Alaska. And so if someone goes snowbird somewhere and gets their flu shot, then maybe we can also see that it shows up in VacTrAK, which will just give everyone a more complete vaccination record, which is important for that individual, but also important for their healthcare provider in making those decisions for vaccinations.
Well, that's huge news because I know that's come up quite a bit in our snowbird. We're Montana, Wyoming, Alaska, everyone heads south. So
Right.
we were just talking about that. So I think that's wonderful. That's a huge movement forward. I look forward to seeing that.
Yeah, it'll be fun. It'll be this spring, late spring. We won't push it.
Well, I hope everyone that isn't enrolled reaches out and looks to seeking enrollment for VacTrAK. I just think that with some of the advancements and some of the projects you guys are working on behind the scenes, this will help us to keep an eye on resident vaccine records and help with just general other compliance type objectives we have in the long-term care setting. And we all have limited time, so to be able to log on and check those records and see if someone's fully vaccinated or up to date sure seems to be a time saver. So thank you.
Yeah, that's great. Yeah, I wanted to highlight one last webpage, and that is our Let's Talk Vaccines initiative. So this is really a partnership. Right now, it's still pretty centered on vaccine providers, but we are hoping to expand it in the next year. And this is really talking about what we talked about today and talking to patients about vaccines, recommending vaccines, and motivating patients to seek out their vaccinations that they're due for. So this isn't super dynamic, but we do have some resources available if you have questions or want to look at schedules, and also a number of online trainings available. And we also are having an ECHO series. We meet monthly, and the ECHO series covers a variety of topics, but I think June is scheduled for an adult vaccination summary. And yes, thank you for sharing that Alaska Health Misinformation Response webpage also. That's really a great website from our partners at UAA. And then also on this Let's Talk Vaccines page, we also have a mailing list. We send out about, about weekly emails about vaccine updates. So if you're interested in that, please sign up. But I will just preface and say that a lot of those updates are really targeted at people who are enrolled to receive state-supplied vaccines, but we also cover general updates. Like there were 3 MMWRs published last week, so we highlighted those. Those were all focused on childhood immunizations. We also cover any changes in ACIP recommendations and anything that's changing with our program, which is a lot. So feel free to sign up for that if you are interested. And yeah, happy to take any other questions too.
Anybody? And this will be recorded and we'll send it out afterwards, and we'll post it to our Mountain Pacific website as well for reference.
Great.
Ivan says thanks. Kate says thanks.
Thank you, everybody, and hope you all have a great rest of your day.
All right. Well, thank you, everyone. If you think of any questions, just shoot us a message and we'll reach back out. And again, we'll share this recording shortly. So thank you.
Awesome. Thanks so much, everybody. Have a good one. Bye.
Thanks, Sarah. We really appreciate it.
You're welcome. Bye.
Bye-bye.